Welcome to Empowered. I'm Elizabeth Naumovski. We talk a lot about hot flashes and hormones, but what about the brain during menopause? Many women worry about memory lapses, brain fog, or focus issues, yet few realize how closely these symptoms connect to hormonal changes in midlife. So, what's fact? What's myth? And what truly supports brain health? Today, we're exploring the science of menopause in the mind, the most common cognitive changes women experience, and the lifestyle and evidence based strategies that can help protect and strengthen your brain for years to come. So, to guide us through all of this, I'm joined by Dr. Sandra Belfry, a clinical neuropsychologist and clinical psychologist. She's also the founder of Menolink, Connecting the Dots. She's a clinical director of the Women's Menopause and Brain Health Clinic at Lifespan and a clinical director at Lifespan Psychological and Neuropsychological Services, Healthy Aging and Dementia Clinic. Dr. Belfry, welcome.
Thank you. Thanks for having me here.
I'm very, very excited to speak to you about this because there's a lot of women who email me and ask about their brain and brain fog and everything else. So let's just begin. What does a clinical neuropsychologist and clinical psychologist do?
Well, I'm glad you asked me that because a lot of times when people are referred to me, they don't even know why they're there or what they're there to see me for. And so I do like to start always by explaining that. And so a clinical psychologist diagnoses mental health conditions like depression or anxiety disorders, and then uses a talking therapy. People have heard of cognitive behavioral therapy, CBT or IPT, to help treat those conditions. And then a clinical neuropsychologist actually looks at the various aspects of our thinking skills. So we measure things like memory skills, attention skills, executive function, language function. And we look at all those skills in order to assess and diagnose conditions of the brain, which could be traumatic, like a brain injury, or non traumatic, like a medical condition, such as a neurodegenerative condition like Alzheimer's disease or
Okay.
dementia.
So, what led you to specialize in neuropsychology with a focus on women's brain health and healthy aging?
Um, it's an interesting question because I've had sort of two paths in my career, but I've always been very interested in sexual health and health education and dementias and aging. And so I've always kind of flipped between the two, and had a lot of passion for helping people without a voice. And so that caused me to spend a lot of time working with seniors and people with dementias. And over the years and becoming a psychologist, I started in Burlington a healthy aging and dementia clinic, which I've had for about 15 years at Lifespan Psychology. And what's happened more recently since COVID is the referrals I get from physicians and neurologists are getting younger and younger. And at the same time, I'm approaching perimenopause, going through it, and menopause. And I'm noticing I'm getting a lot of younger women who are middle aged sent to me with cognitive complaints. And so I realized how the two things were merging and really needed to be addressed in tandem. So I started a new clinic, a women's menopause and brain health clinic, but also spent a lot of time researching in the past few years and kind of re-educating myself about hormonal health and how it impacts healthy aging.
And I think this is really important because growing up, there's no one there to guide us and tell us about this. It's always been taboo. And
That's
I
right.
remember when I first started talking about menopause and perimenopause back in May 2023, no one was really talking about it on TV. It was still a bit of a taboo. So, what I want to ask you now was how has your personal experience shaped your understanding of menopause related cognitive and mood changes?
Yeah, well, I didn't really have anything to expect in that regard. So I thought, I'm going to get hot flashes, and that was there'd be changes in your cycle. But I was surprised when other things started happening, and I could notice timing, and spoke with my doctor. And really, because I had some unique experiences and some common ones too, I had a difficult perimenopause overall. And so that just really caused me to stop, pause, and take a look at, what are we doing in mental health that's recognizing these reproductive health transitions?
And I think this is really, really important. When we come back, I would like to talk about Menolink. I want you to explain to me what Menolink is and how it's going to help women of all ages. So please don't go away. Welcome back to Empowered. I'm Elizabeth Naumovski. Mind and Change, why menopause knowledge matters for your brain health. And this is today's topic. So, Dr. Belfry, I want to talk to you about Menolink. I know nothing about it. I know it's brand new. Could you please tell us about it and tell us about the intergenerational approach to education?
Yeah, so one of the things that kind of occurred to me in working as a clinician is that some people just need information and they need to know what's evidence based. And I'm sure you've seen on social media, there's lots of misinformation out
Yes.
there. And a lot of friends, families start calling me, and so what's true, what's not true about menopause. And then I started talking to my daughter and younger women, like, do you know what to expect? And they didn't. And my bigger concern is also about today's senior women. And has anyone talked to them about um, the maybe lack of menopause treatment that they might have had and what it means for them right now as an aging senior and their brain health?
Mm.
And as I started putting that together, I realized I needed to create some psychoeducational workshops that brings women together of all generations to talk about how basically the three reproductive phases that can occur for us. Two are guaranteed. You're going to hit puberty and you're going to hit menopause, depending on your lifespan.
Mm.
And also, some women have children. And then we know that there's hormonal changes in that reproductive phase as well. So, do women actually know what to expect, or young girls with puberty, with postpartum, and then with perimenopause, menopause transition, in terms of how there can be mental health changes or cognitive changes? So I know we all kind of agree that we've talked about postpartum depression, and we understand that things might be, there'll be risk factors for some people at that time. But what people really don't know is there's also higher risk for developing anxiety or depression at the time of puberty, and again at the time of perimenopause. And so I started doing a lot of research and putting information together. And Menolink is about presenting evidence-based information. So all of the information I present is taken from the Canadian Menopause Society or the North American Menopause Society, which is now called the Menopause Society, and the International Menopause Society. So they're sort of the three main organizations that produce information or position papers for physicians on how to treat and what is the most recent agreed upon research in the area. The other place where I get information from is the Women's Brain Health Initiative.
Yes.
So
Yes.
they specifically obviously talk about women's brain health in particular. And so we know that women are overrepresented in dementia, about 2/3.
Yes.
And so we don't really know why that is. And so one of the reasons why Menolink was created was my concern about that. And maybe it's because women don't have enough information about preventative strategies or health promotion strategies for brain health across the lifespan. So that's one reason.
And I think this is really, really important, really good work that you're doing, because there's all these generations that have been growing up that know absolutely nothing about their bodies. They were
That's
never
right.
taught, they don't teach you any of this in school.
That's right.
Parents don't talk to you about it.
Yeah,
Mothers don't want to talk to you about it because they're afraid they're going to scare you. And so we're kind of lost, just hanging around,
that's
right?
right.
And I
Yeah,
think this information is really, really important because there's so much misinformation out there on social media, and we need to rein it back in. So good on you for doing this, because I think you're doing really important work. I want to talk about misconceptions. What
hmm.
misconceptions do you most often encounter regarding menopause and the brain?
One of the biggest ones right now, and thanks, that's a really important question, is a lot of women are afraid that if they don't get hormone treatment during perimenopause and menopause, that they will get dementia. And so they think there's a direct link. And that's not the case because, like I said, every woman who lives to the age of menopause will go through menopause. And as they become a senior, we see that not 100% of women have dementia.
Okay.
So, not every woman needs to have hormone therapy. That is an individualized approach. It depends on each person's background. So, we don't need to worry that if we haven't had hormone therapy that we're getting dementia. It's not a direct causal relationship.
And I think this is really important because I know there's another generation out there that hasn't had any hormone replacement therapy. And now they're worried.
Right.
They think that everything in their life is going to fall apart as they get older. So please don't go away. We'll be right back to find out what cognitive symptoms are most common during perimenopause and menopause. Welcome back to Empowered. I'm Elizabeth Naumovski. Mind the Change: Why Menopause Knowledge Matters for Brain Health is today's topic. So, Dr. Belfry, let's talk about cognitive symptoms. Um, they are the most common during perimenopause and menopause. Or is that true or is that false?
Um, More so in perimenopause, we see complaints of brain fog. And what the large scale research tells us is the most common change one might experience in perimenopause is your verbal memory, which is your ability to remember things that you hear. And so it's not that women have impairments in verbal memory, but they might have mild, what we call a mild relative decline, or an inefficiency, but it's temporary, and things return to normal once someone moves into the postmenopause phase.
Okay, well, that's good to know that, that you don't have to worry about that.
Yeah, and so yeah, to be clear, these symptoms are temporary, but for some women can be a lot more debilitating than others, and so there are reasons, probably other factors at play when you see you're having more difficulty with something like brain fog. There could be a combination of factors like poor sleep or significant mood changes that are in the clinical range, like a clinical depression or a clinical anxiety.
So, do women experiencing perimenopause experience a lot of mood changes?
Um, the most common mood changes reported are irritability and mood swings. Um, and about at least 40% of women report having mood changes. So, what I think is really not well outlined in the research right now is how many women might develop a clinical. We do have some data on that, but I just think we haven't asked the question in the right way to really get at what's truly going on. And so that's a lot of another reason behind Menolink is to help educate women about what are mood symptoms and when should you be concerned or that they're in a clinical range. When do you need to get treatment?
So, what lifestyle factors contribute most strongly to protecting brain health during midlife? This is a very important question.
It is. It is. And so I think it's something that's been talked a lot. So we have vascular risk factors. But I want to say the first most important factor that we're going to see coming out of the literature, it's already in the literature now, is sleep. You need to be properly addressing your sleep throughout your lifespan. But if there's a higher chance that there'll be interruptions to your sleep during perimenopause and menopause. And so getting the right assessment and treatment right away will be very important for maintaining better brain health.
Okay, so let me ask you this. I go into the office in the morning and there's four other women and everyone is up at 2:30 in the morning.
Yeah,
Why is 2:30 the time that everyone wakes up?
yeah. Well, I don't know why it's 2:30 per se, but what happens at this time, the newer research is showing that our hypothalamus might be impacted during perimenopause and menopause. And so the hypothalamus regulates our circadian rhythms for sleep as well as our temperature. And so, one of the things that wakes you up at night is when your temperature rises. So, because women who are going through perimenopause start having hot flashes and night sweats, that's what's waking them up. Or the other piece is having to go to the washroom in the night due to other changes associated with what we call GSM, the genitourinary symptoms of menopause. And so that's two factors there that could be causing people to wake up at 2:30, 4:30, and then not to mention maybe anxiety or stress.
Oh yeah, so yeah, it's
Yeah,
it's
it's
a
a lot.
plethora of
It's a
things.
lot. Yeah.
Okay, so before we go to break, I just want to start on this question. What lifestyle factors contribute most strongly to protecting brain health during midlife?
Um, well, managing sleep. We'll
Yeah,
go
well,
there.
yeah,
Yeah.
that's a given.
Yes. So sleep, but so important in people. So what people don't know is there's a multi-pronged approach to that. So it could be um, medication for some, but we haven't had a lot of great options, but new ones are coming. And then there's talk therapy. So I do something called CBTI. It's a CBT for insomnia. And so going methodically through people's sleep hygiene is something that I work on with people. And then other lifestyle factors, of course, are having good aerobic exercise, strength and weight training become very important at middle age, and nutrition.
Hold that thought. We'll be right back with more with Dr. Belfry. Welcome back to Empowered. I'm Elizabeth Naumovski. Mind the Change, Why Menopause Knowledge Matters for Brain Health is today's topic. To guide us through all of this, I'm joined by Dr. Sandra Belfry. Dr. Belfry, we had to go to a commercial break and we didn't finish talking about what lifestyle factors contribute most strongly to protecting brain health during midlife. So please continue.
Um, Thank you for the question. And so it's important to talk about maintaining our vaginal health throughout the lifespan. And so, not so much a lifestyle factor as traditionally described, but what women might not know is that 70% of women experience the genitourinary symptoms of menopause. And so, those symptoms can lead to increased chance of urinary tract infections over time from middle age and up. And so left untreated, and there's many simple treatments,
Hmm.
as you age, you can be, say, as an older woman, more prone to having urinary tract infections, UTIs.
Yes.
A senior woman who has a UTI is at very high risk for developing delirium. Delirium is a sudden onset confusion. One episode of delirium in your life can put you at higher risk for developing dementia. These are very simple fixes that we're not talking about in society today. And that is preventing UTI in order to prevent delirium. A lot of the physicians know, and people like me know, but everybody out in the public doesn't know. And so it's one of the main reasons for the MenoLink workshops
Yep.
is to teach women how to help prevent their mother's UTIs, prevent their own, and teach their own daughters about how to prevent that across the lifespan. And it's something we should actually be working on from the postpartum phase.
Wow, this is important because I know so many women that have UTIs and I'm sure they don't even know
No.
about the delirium
And
factor.
and there's simple treatments out there, and they're all approved by the guidelines. So
So
yeah.
let's talk about exercise or
Yeah.
activities. What have you found effective for improving cognitive performance in women?
Um, well, getting proper sleep, we'll go back to that.
Yeah,
But
that sleep thing.
one thing we know about cognitive performance in general is if you exercise before you want to learn information, you will have a higher chance of actually learning that information. So taking a brisk walk before you say go to a lecture or attend a meeting or that sort of thing. Not everyone can implement that, obviously, for work purposes. But yeah, there are many things to consider when you're trying to improve your cognitive health. But the main thing is to keep being socially interactive
Mhm.
as well as continue to learn new things and not simple things, more complex things, things that are novel to you. Really important. The main things that help with improving cognition are learning a language or an instrument. And languages these days, coding is something. For
Yep.
example, myself, I'm learning how to do my own website, and that involves a little bit of coding and other things. And so those things can really help you with improving your cognition.
That's great. And I always say, keep learning because it
Right.
just keeps your brain going.
And keep socializing.
Yes, I think that's really important, especially
Hmm.
surround yourself with a really good community.
That's right.
And that seems to be the theme in almost every show.
And start young. Don't wait till you're 70 to do that. Start in your 20s. You build your social circle over your lifespan and keep doing it. If you move cities, build a community within your new city. Keep trying.
So we've got less than a minute left.
Okay.
Last question. This show has gone by so
Yeah.
quickly. Tell me about one or two things that women should focus on to foster better brain health this year.
I think it's really one, address mood symptoms. If you're having any kind of depression or anxiety symptoms or other kinds of trauma, be preventative about your mental health. Go see someone like a physician or a psychologist, and get the treatment. Find out about the treatment you need and get it. And also be very thorough in going over your reproductive health, hormone health with your physician, and how it impacts things like your mood, your sleep, and your cognition. Visit a neuropsychologist. We're here, we'll give you feedback.
This has been an incredible episode. Thank you so much. I've learned a lot. I know you're going to help a lot of women out there.
Thank
Thank you.
you.
Dr. Belfry's words of wisdom to you are I hope to connect women of all ages, their families, and healthcare professionals with clear, trustworthy education about menopause, cognitive health, and the factors that shape better brain health across the lifespan. I invite you to pause, connect, and discover how empowered knowledge about menopause and brain health can change your journey and your future. Thanks for watching.